Last month, the state of Maryland approved $454 million in additional budget cuts for the current fiscal year. The state cut local aid to counties by over $200 million.
Well, it's a little over $8 million to Howard County, about $7 million to our general fund. And the reason why that is such a tough cut to absorb is that with the state maintenance of effort laws, only about 30% of our budget is non-education or debt service. So that cut has to be absorbed by public works, public safety, sort of the basics of county government. Immediately we suspended all road resurfacing, so there'll be none of our road resurfacing projects will continue, and we're working hard to find the rest of the money to balance the budget. But it's going to be tough. We're already holding, many positions vacant. We have a hiring freeze. We have a furlough that county employees are taking, which was already in our budget. And so to get cuts during the year is tough. On the other hand, I'm glad that we got them 2 months into the year, so we'll have 10 months to absorb them, and we'll do it. We'll be able to do it. But I am very concerned about where we're headed with this economy over the next year's budget, and frankly the state may push further cuts down on counties as revenues come in.
Funding for community colleges statewide is one area to see reductions.
Well, the state budget cuts pretty much wiped out the increase that we received from the state this year. It was $693 that we received. The cut was $653, so that left us with $40,000. So it was a sizable cut, pretty much took away everything. And so it was, something that we weren't expecting. We're hoping wouldn't happen. We knew there would be a cut, but we didn't realize it would be of that magnitude. The impact that the students will see, I think, has a lot to do with the growth that we have on campus right now. They're feeling that impact really because we haven't been able to add staff to accommodate the growth. So it's really all tied together. The growth has happened, the reduction in resources to help meet that growth. That's really where the impact is. I anticipate that there probably will be statewide another cut. I'm hoping it's not on the backs of community colleges once again.
The Howard County Health Department is cutting to the bone in applying state-mandated budget cuts.
We have about $800,000 in cuts out of a $17 million budget, so a pretty significant cut, and it will result in about a 10% layoff rate here in the health department. So out of our 150 or so employees, we're probably going to lose close to 15 of them. The two things are happening with the flu this season, both of which are being impacted by the budget cuts. We are doing a massive effort to get everybody, as many people as possible, immunized against the seasonal flu. We are then going to be going back with the school system in October, mid to late October, with our staff and their staff, and unfortunately our staff will be cut by that time, to be able to provide H1N1 vaccine when it becomes available for all elementary, middle, and high schoolers. So again, these cuts don't come at the best time.
This is really the first time the community providers in the developmental disabilities system have had a rate cut in probably 20 years.
The Arc of Howard County, an organization that provides services to people with developmental disabilities and their families, is dealing with approximately $200,000 cut from their budget.
We have come up with a plan. We'll have to reduce some vacancies, some staffing, which are currently vacancies, but they are direct support positions. So they will, it will mean that people will have longer waiting times for services. They will, in our employment program, people will wait longer for somebody to help them find a job. They'll have to wait until somebody is available to job coach them. In our day program, it will mean that they will have one less staff person to take care of their needs, and the people in our day program have they have very significant disabilities and really need the staffing to do just about anything, but we'll have one less staff person in that program. Families will wait for services. Some families will do without services. They won't be able to use our respite care home because they won't be able to pay for it. It's really going to directly impact on both the running of our organization and also on direct services to the people that we support.
Frankly, moving forward, there's there's nothing easy left. Not that the things we've done have been easy, but we're talking about hardcore services at this point, and it's going to be challenging, but we'll get through it. We're Howard County.